Okay, I'm here at the Joint Strategic Needs Assessment event, and what's your name, please?
I'm Judy White. I'm director of something called Health Together, which is based up at Leeds Met University. And I've just been asked to come in just to try and listen in, manage the group activity, and then do a bit of summary at the end of the key issues that are coming out.
And how have you found the event so far?
Well, I think it's great to have these events which give people who are out there living and working in the communities of Sheffield a chance to feed in to the JSNA. And I think it's particularly good that the council are listening to what they're calling voice evidence. So they're not saying, okay, you haven't got lots of numbers, so we can't take it seriously. They're actually saying, yeah, your anecdotal evidence is of value, your report, your evaluation is of value, and we'll try and build that in. And they're wanting to hear what things people are doing that are working and making a difference. And they're also wanting to hear about what the issues are in these difficult times we're living in.
Absolutely. And what do you see as the role of the JSNA going forward?
Well, I think it needs to be very much a dynamic document. Well, not a document really. It's got to be where you can go to get all the detail of information that you want about not just needs in the city. I think it's really important. It's also about the assets of the city, and a lot of JSNAs are now actually calling themselves JSNAs, Joint Strategic Needs and Assets Assessments, because it's about saying, okay, we're living through difficult times. There's a lot of need, but there's also a lot of great things about the city of Sheffield. And I don't come from Sheffield, but I've heard a lot today already about all the things that are going on, and just the people here in the room are a huge asset to the city. So it's about gathering a place which gathers all that information together, but also that presents it in accessible ways that people can make use of. We don't want just reams and reams of data. So it's a living, working document and process, so that the city can prioritise what it does, particularly as money's getting so tight and there have been so many reductions in funding available to the local authority.
That's brilliant. And what does Health Together do? What's the role of your organisation?
Well, we're a university, so we've done research and evaluation into the difference people are making in health. So whether it's through volunteering, through non-clinical lay people getting employed to support people to change health, whether it's ways of engaging people in this sort of process. And so we know quite a bit about what works, what makes a difference, and we're offering to come out and do things like this, facilitate, evaluate things, do bits of training, do research and so on, and so that we're connected to practice, because there can often be a big gap between universities and us studying things and actually the practice in reality, and we're trying to bridge that gap essentially.
That's brilliant. And for you, what are the main the top three issues in health? Like, you were talking about the wide determinants of health today. What for you makes the biggest impact on people's health and well-being? Thinking about things we've already been discussing, like the economy, like housing, like employment.
Yeah. Well, income is a huge issue, isn't it? And poverty is a huge issue. I mean, it's shocking that Sheffield, a fifth of households are living in poverty. And this is growing, and it's the majority of people who are in poverty are in work. So it's households with people somebody at least in the house is working. So it's not just people on benefits. And this is a real worry, because obviously people haven't got the money to buy the means of being healthy, whether that's good housing or being able to keep warm, being able to eat properly. It really has such an impact on them. But it also affects the mental health situation. That's a huge issue. And we've heard a lot today about early years, critically important. So I feel very concerned for children who are growing up in impoverished households where they don't have access to the sorts of developmental opportunities that young kids need, because that you can't reverse that later on in life. Education is hugely important. Employment, but decent employment that's not going to damage your health is so important. And we really need to be addressing these things and looking at prevention rather than always picking up people when they're further down the line and they're already ill, and it's too late for them. in many ways.
Absolutely. Thank you. That's so brilliant. Thank you so much. Lovely to talk to you, Judy. Cheers.
Thank you.
Thank you.